Okay, it looks like we're live. Thank you so much to everybody for joining us for our latest installment of our third Thursday Google Hangout. I'm Neil Shah, I'm the founder of Costs of Care, and we've been working with the ABIM Foundation and Choosing Wisely on highlighting some of the really amazing innovations across the country that educators have been bringing forth to really kind of push the healthcare system towards the future, particularly in terms of making sure we're delivering on making care affordable and safe and a good experience for our patients. And we've been doing these webinars now for quite a few months. They happen on the third Thursday of every month, and just great to have everybody here. These webinars have three components. We talk to both on-the-ground leaders and national leaders to be able to give people a sense of the kinds of tools that are out there and things that they may want to adopt themselves. There are, after the webinars, we post them for everybody to be able to view after the fact, but we also have discussion groups through Google Hangout, so you can continue to interact with the innovators that we feature. And there's also the opportunity to review the tools that they share. So today we're very, very excited to be speaking with Miriam Schechter from Albert Einstein School of Medicine and Dominic Lorusso from Consumer Reports, who've found a really cool way of partnering to help educate medical students. And so I'm going to turn it over to them in a moment to share a little bit more about their innovation, to discuss some of the sort of pragmatic issues around how they went about implementing it, and then to think with them about some of the challenges or barriers that may arise for other people who are trying to do similar types of teaching. So with that, I'll turn it over to you, Miriam.
Hello, I'm Miriam Schechter from Albert Einstein College of Medicine. I'm a general pediatrician and pediatric clerkship director, but I also chair what we call at Einstein the Clinical Directors Committee, which oversees the curriculum in the clinical years and the third and fourth years. As part of a initiative to teach high-value care within a larger longitudinal course called the Population Health and Practice of Medicine course, I was responsible for putting together a faculty development program to kind of kick off this initiative to teach high-value care to medical students. We ran a full-day event for our clerkship leaders and our course directors and interested faculty to teach them about what the importance of high-value care is, how we can teach it to medical students, how we can assess medical students using it, and how we can try to incorporate it into our learning. I'm going to show you kind of the outline for the day, which brought in some experts and local faculty. It included some an overview of the importance of choosing wisely, and then we had the opportunity to partner with Dom Lorusso from Consumer Reports to tap into a huge catalog of consumer materials meant for patients that we thought could be of tremendous use for our teaching efforts with medical students. So maybe he can tell you a little bit about kind of how he came into this and the background from his end, and then we can talk about how we partnered.
That'd be great. And Dom, if you could actually maybe even start off, of course, introducing yourself and your role at Consumer Reports, but how you guys got together in the first place.
Sure. Thanks, everybody, for joining. My name is Dom Lorusso. I'm the Director of Health Partnerships here at Consumer Reports. One of my major roles is managing the Choosing Wisely campaign from a consumer perspective. Basically, what we do is, and what my role here is that we create resources for our partners. We have about 60 partners around the country They range from not-for-profit organizations, large not-for-profit organizations, to very small organizations. And the whole goal of what we try to do is work with them to disseminate these very rich resources that we've created in the Choosing Wisely campaign. So part of my role is to develop techniques for them to help them disseminate and reach their audiences. The other part of what I do is manage the editorial process for the actual Choosing Wisely pamphlets and brochures that come from recommendations from the medical societies. I have to apologize because I don't actually recall how Miriam and I did get together. Maybe she can recall that a little bit, but I do know that one of the offerings that we do for partners is create these co-branded microsites, which I know Miriam is going to get into in a second, and I'll explain in a little more detail as we go through it. So I'll turn it back to you, Miriam.
I think it was our Associate Dean of Education, Pablo Ho, who had a connection to Consumer Reports and thought it would be a good idea to get us together.
That's how all the great partnerships are. You can't even remember how it got started. So.
And when we heard about what they were offering to these other organizations, we thought, wow, why don't we do this for our students? And Dom said, well, no one's ever done that before. We've never partnered with a medical school, but this would be a great way to expose our students to what's out there and available, and hopefully get them to use it in the course of clinical care. So he shared with us their tremendous kind of repository of materials and brochures, and what we did is we asked our different clerkship directors and course directors to look through them and see which ones would be relevant to their course or clerkship and that they would want to have their students access during those courses or clerkships. They provided a very simple set of instructions for us. We simply had to make an Excel spreadsheet where we put each of these different brochures into the right tabs, the right clerkships or courses that we wanted. We were able to choose our own kind of quote, and we chose Einstein, students choose wisely, and an introductory paragraph. And it looked like this when you come to our personal website, you'll see this is co-branded with Einstein and Consumer Reports, and you'll see on the left-hand side all the different clerkships that wanted access to the materials, and kind of a welcome page. And this link is available through our learning management system that students access all the time. So each clerkship page has a link to this site, so students can quickly get to it. What happens is when you click on one of these tabs, you will get to a list of available brochures, and maybe I'll let Dom talk a little bit about the brochures and the content of the brochures and what they look like.
Sounds good. Thanks, Miriam. I'm going to share a screen here, so just give me 1 second as I work out the mechanics on that. I'm having a little problems. Sorry about that.
As Dom works on that, one of the things that I think is great about this is that I think for educators who want to teach about high-value care, one of the big challenges is where the content lives. You know, there's a sense that there isn't really great off-the-shelf information to pull. So I think one of the things that's really, you know, sort of creative about this is that, you know, the idea of partnering with Consumer Reports around content. And the other dimension of this, which I hope we'll be able to get into a little bit, is that this is content that was originally designed for patients. It's almost reverse engineered content that was aimed at, you know, the clinical professionals for patients. That's now being turned back to medical students, and you know, there's the dimension around the content itself and what students need to learn, but there's also the sort of communications piece in terms of how we think about conversing with our patients about this stuff that seems embedded in this kind of information. And I'd love to hear about how you guys think about that as well.
Exactly. After Don kind of talks about the brochures, I can talk about how we are using these and envision using these for our students. Absolutely.
Great.
Okay, I believe I have the screen up now, but just on the left-hand side of the screen, you see the Consumer Health Choices webpage, okay, and that's, again, a co-branded microsite that we create for organizations. I'll get into very quickly how we create that, but I just want to talk very briefly about the brochure itself. On the right-hand side of the screen, you see a Choosing Wisely brochure. That's a typical brochure. As you can see, it's branded with the Choosing Wisely logo. It has Consumer Reports logo and the ABIM Foundation, but more importantly, and not to undermine, undersell any of the other ones, this is a recommendation that comes directly from the American Academy of Pediatrics. So this is one of their Choosing Wisely recommendations about antibiotics for sore throat. And what Consumer Reports does is we work with the society, the medical society themselves, and create a plain language, an English translation, a consumer-focused piece that allows a consumer or a patient to really understand what's behind the science and what's behind the recommendation itself. So that's a pretty standard brochure. They're generally 2 pages in length. They will cover what the recommendation is, and then advice from Consumer Reports, as a lot of these recommendations are what not to do or what you may not need something. Consumer Reports tries to give advice about how you can manage your colds and flu without antibiotics. So this is a pretty standard format. We have created about 100 of these right now, based on all the different recommendations from the societies. On the left-hand side, going back to the microsite, these right now what you're seeing is a highlight of what the pediatrics topics are. And as Miriam said, this is an incredibly flexible format. I give a shout out to my colleague David Ansley for designing this. But basically, we have about 50 of these microsites. They take very little time to get them up and running. They're very flexible. You can decide, or anyone can decide what they want the left-hand navigation to be. We help you fill it in. I mean, the benefit here is that we'll maintain this for you. It is a co-branded site. You can link to it and support it that way. But overall, it is a repository of consumer recommendations, consumer material that helps patients, helps them understand the recommendations coming out of Choosing Wisely. And again, the microsite is there to really help provide a direction on how to get to the access to this. So I'm going to turn this back over to you, Miriam, and
Okay.
a little bit more. I will stop sharing.
Okay. So once we had that microsite set up, really our goal has become to disseminate that to our students at all different levels in their time with us. So starting in the courses, we're having faculty in courses refer to some of these brochures within discussions about topics on diseases. So maybe they're talking about breast cancer and can show the students the brochure on breast biopsies and why or how they should or shouldn't be done. So we're hoping that the more they hear about it in the first 2 years and learn about both the Choosing Wisely recommendations, but also the microsite and these available brochures. Again, they're kind of getting the content, but also helping to prepare them to use the brochures in the course of clinical care once they hit the clerkships. So ideally, we have a student seeing a patient in their pediatrics clinic with a cold and a mother who's trying to push them for antibiotics, and they can quickly access our microsite, get to that exact brochure that Dom just showed, print it out, and use it as a basis for a discussion. It's easy to understand. It can really kind of form a good foundation to start the discussion. It kind of looks official, which is nice, and it's something that the patient can take home with them. So we really want students making it part of their routines, that they go and access the site, print out the brochures, and use it to improve communication between them and patients on the Choosing Wisely recommendations. We've also incorporated, we've run a pilot conference in the pediatrics clerkship where we have teams of students coming up with an evaluation and treatment plan for a wheezing young child, and they are, once they come up with their plans, are given information on costs of their evaluation and treatment, and are then taken to the Choosing Wisely recommendations from the American Academy of Pediatrics, and also shown our microsite with the brochures so that they can literally walk out of there and apply it and use it in the emergency room, on the inpatient floors, in the clinics, and make it kind of readily available to them.
Great, Miriam. Thank you so much. I think that example actually adds a lot of sort of clarity to the way that this could be used as a tool. And it actually makes me think that not just medical students, I wish I had access at my fingertips to these sorts of tools in discussing things with my patients. But and Dom, maybe that's something you can help us figure out.
Absolutely.
with for me personally, but for everyone else who's listening. But so Miriam, I've got a couple questions maybe to sort of kick things off, and then I'll say for people who are listening live, you should feel free to send us questions at any point. So one of my questions is, this seems like a great resource for medical students, and it's clearly sort of set up for medical students to be the end users. But one of my questions gets at what a lot of, I think, students often feel is a barrier to practicing high-value care, which is the clinical environment around them and the role of faculty and how they think about it. So have you thought about that challenge, and how have you sort of tried to engage faculty in the availability of this resource and actually getting it used?
Right. I mean, I think that definitely is a challenge, and I think that will kind of have to come from kind of the clerkship level on out. So engaging clerkship directors and having them kind of start to incorporate this into their teaching, but that's going to also involve faculty development as well. It's and you know, a lot of this is just kind of getting the word out and raising awareness. You know, most of our faculty don't know that we have this microsite unless they happen to be at our, you know, our clerkship retreat that day when we started. So I think that will hopefully happen on the clerkship level. You know, as it becomes incorporated more and more into teaching, and we get the word out to faculty. You know, the other thing is, as lots of these things go, sometimes it may be the students kind of teaching the faculty. Oh, wait, we have access to these great handouts. Do you know about these handouts? Can we use this to talk to our patients about, you know, why they, you know, don't need a chest X-ray today, you know, for their pre-op testing or whatever it may be. So I think it's going to have to come from different directions, but like kind of all new innovations, you know, dissemination is always is the challenge.
That makes a lot of sense, and it sounds like this is fairly early stage, but just
Correct.
to orient everyone who's listening, how recently has this gone live, and
Right.
how much experience do you have so far with it?
So it went live, I guess it was the end of May, Dom.
Yeah.
And as Dom said, I mean, it was very simple to do. They made it very easy. His colleague Dave, I mean, I sent him the spreadsheet, you know, within a day the microsite was up. Again, like everything else, there are always different levels of interest. So I have course leaders calling me and saying, you know, we're going to be teaching about this. Can you add a brochure on, again, you know, breast biopsies to our course tab, because we're going to be referencing it in our course. Have I had every course leader do that to me? No. Ask me? No, but some have. And similarly in the clerkships, different clerkships have kind of started incorporating this. It really was just in May, so we're 6 months into this. Family medicine is working on an OSCE as part of actually an ABIM grant to kind of assess students and how they talk to a patient about specifically starting and not starting antibiotics for a URI. So it's kind of starting to seep out there, but we're hoping in the next, you know, 6 to 12 months it will kind of continue to be used. And I think the more it's used early on in the first 2 years, it will kind of creep through as students march through as well, and they'll be familiar with it. Now I have my third-year students saying, oh, what's choosing wisely? I don't know what that is. Others, especially I've had students who've rotated through radiology, for example, and have heard about it through them and the ACR criteria. So, you know, again, it's getting the word out, and that takes time.
Yeah, that makes sense. So I've got a burning audience question for Dom, but which I'm sure you can actually guess what it is, Dom. Everyone just wants access to these. But before we get there, just to follow up on what you were just saying, Miriam, so you've got a few, it sounds like, early adopters / students who are excited about this. have you thought about what the best ways might be to sort of track, the ways that people are using it, like sort of the use cases, and that kind of thing going forward?
So first of all, one nice thing is from the Consumer Reports end, they can actually give us data on microsite hits. So we can literally find out how often our students are going to the website. So that's something we can actually track over time, and that hopefully will give us some information just on usage, which is nice. As part of our initial kickoff retreat, we actually had each course and clerkship submit a proposal for how they anticipate integrating Choosing Wisely recommendations and the use of these materials into their course and clerkship. So we have something to start with, and everyone had to submit a proposal. Now it's a matter of kind of following up with them. How's that program going, or how's that new conference going? Or so at least we kind of have something to start with from everyone. So again, we kind of made it a requirement of the day that people had to submit a proposal, and we need to kind of follow up from there. So that's one way. While we had everybody in one place, to get them on board and hopefully get them to follow through.
Great. Thanks, Miriam. So, Dom, this is from Chris Moriades at UCSF. How do we all get access to these resources? Exclamation point.
It's a very simple process. First of all, they're all available today on our website, consumerhealthchoices.org, and I can send a URL out later on to point you directly to it. So anyone can go there. They're free to access, they're free to download and use them from that particular site. If there's interest in creating a microsite, as Miriam has described and how we've shown, that's a simple process as well. Someone just needs to reach out to me. You could reach me at dlorusso@consumer.org, and I can help you get started on one of them, setting one of those up. Again, the process is simple on our end. I think the more complicated process is on your end in identifying how you want the content laid out, what areas you want to focus on, and so forth, because there is a lot of flexibility in how you can design it. But again, we could walk you through that process.
And I would think, Dom, that part of what's attractive about the microsite as opposed to, well, definitely it's consumerhealthchoices.org, is that?
Yes.
So we'll post that on our site for everybody to have. But I would imagine that one of the advantages of the microsite as opposed to going to consumerhealthchoices.org is the customizability and the ability to also sort of meet people where they already are. I think one of the things that's very cool about the partnership with Einstein is, I guess, the students are already sort of, there's a platform where they're accessing resources where this lives. Is that right, Miriam?
Exactly. So, on our learning management system, each course and clerkship has a site, and students are constantly accessing that for all types of materials. So they're on it already. So now they can just go directly from there to our microsite and access it quickly. I should also add, while there aren't currently brochures for every single Choosing Wisely recommendation, they are constantly, Consumer Reports is constantly adding new ones, and so the microsite is dynamic. It can, I'm on Dom's update distribution list, so when new brochures come along, they can be added very easily to wherever we want them on our microsite. We can take things off, we can add things, and as new materials become available, it's constantly being updated. So and so there's just more and more that we can make available to the students.
Well, Dom, you may be overwhelmed with requests soon.
We welcome it.
And I would think actually one of the opportunities might be, just in trying to think about this, I imagine probably a lot of medical schools have some type of platform where students access resources, and not just medical schools, but really all delivery systems. I have when I'm trying to consent patients for surgery, I have a place where I go and I get the consent forms in multiple languages, and imagine there might be a similar opportunity to partner with healthcare delivery systems directly for people who are looking for these sort of, and I think all of us are always on the hunt that work in clinical settings for better brochures and patient communication tools, especially around issues of value that we don't often have native skills in communicating. So Have you had any experience with that, Dom? Have you had delivery systems reach out to you?
You know what? It's just starting, Neil. Most of our partners and most of the ones that we've created have been for employer groups. We have, I think I mentioned about 50 of these microsites out there, and many of them are employers, business groups, health collaboratives. We've had a few in recent months that have started from medical systems, and we can certainly do that. We have no problem doing that. It's something that we feel is really important. A lot of the material that we create for Choosing Wisely, it has been distributed through consumers or through consumer groups, and the benefit of that is there becomes an awareness. The downside of that is that it's not at the point of care. It's not at when someone really cares about the information, so it can be a little bit of information overload. So reaching out to medical practices and medical systems is a great way of getting this to patients at the time they really need it. So we welcome that. I mean, you talk about us being overloaded. We welcome that. We really do, because it is kind of what we see as the next hurdle that we need to overcome, if that makes sense.
Yeah, that's really great. So I'm conscious of the time. We're coming up at the end of the webinar, and I just want to ask, do either of you have anything else before we end that you really think that we want to get out as a message to our learning network?
I would just say, just even in speaking with individual students and showing them what's available, they're very excited about it. They feel uneasy having these conversations with parents or with patients, and I think to have this tool available to them so readily, and again, kind of to use it as a basis of those discussions, I think is kind of reassuring to them and helpful. So. I think it really can help both them and the patients as well.
That's awesome. Well, this is just so exciting. Congratulations to both of you for doing this. I think it's a tremendous resource, and I think we'd love to loop back with you, in 6 months or when you're further along, to hear more about your experience and just sort of what you're learning about how to. It's a great resource and a great tool, but how medical education can sort of be brought along the way. So thank you again so much. Thank you to everybody who is listening today, and happy holidays.
Thank you. Thank you for having me.
Same to you. Bye-bye.